Hi there, guys. So today, what we're doing is we're going to speak with Dr. Sarah today. She is highly qualified in kids chiropractic. So we're just going to ask her a few questions and get to know a little bit more about chiropractic and how it can help kids. So if you want to start it off, tell us a bit about your qualification.
Yep. So I am double board certified through the International Chiropractic Pediatric Association in pregnancy and pediatrics. So the pregnancy portion is the Webster certification. The pediatric portion is lots and lots of hours of hands-on and in classroom experience, learning about the developmental stages of children from infancy, newborn stages, all the way through adolescence, how their immune systems grow, their neurobiology, and just the general what kind of milestones they should be hitting and for anatomy because it's different than adults.
Yeah, yeah. And so if someone was thinking about why they would take a child to a chiropractor, what would you say is the reason behind that?
Yeah, as far as like the teeny tinies, the babies go, the birth process itself is pretty intense. Even if you have the most easy natural birth, it's still a lot for their little bodies to go through. Anything from just the way their cranial bones overlap through the delivery process. Then they go out with what we call the cranial blowout, which is why a lot of newborns look a little crazy at first with that big alien head. And then it all settles together like this. If there's any sort of restriction in the fascia, the soft tissue that causes some of those cranial bones to still overlap, that can cause what we would see in like a torticollis, or if your baby prefers one side and the other, it's easier to feed on one side. Sometimes we see that with the tongue ties as well, really uncomfortable latches, or if they're just like swallowing a lot of air while they're feeding, if they're having difficulty passing wind or colic, constipations, if anything, just a general fussy baby. A lot of times we can see that in the nervous system as they develop. We definitely want to see them that cross crawl pattern. So if your kid wants to just jump straight to walking without crawling, that tells me that the neurology isn't quite there yet. So we want to make sure that both sides of their brains are communicating properly so that they can get that cross crawl motion happening. A lot of times, if you see that like pirate smile in a kid, so just one side goes up, that tells me again there's something wrong within the structure. Their bodies are so small and so receptive to what the world has happening around them that we want to make sure that there's no pressure on their nervous system so that they can grow and adapt in a healthy and biologically, biomechanically proper way.
Yeah. Obviously, that's one of the big things that I think a lot of parents just don't realize at the time is that whole idea of like when you get a baby in and they're saying, like, I had a mother saying, oh, he's got to be a lefty. And you go, well, is he going to be lefty or is it just because there's something neurologically going on that's meaning that they don't know they have a right hand?
Right.
That kind of stuff. So I think it's so important that like that whole concept of it's not just coincidence. They're doing a lot of the things they're doing. If they're bum shuffling, if they're one leg and they're doing that sort of crab walk and stuff like that, it's not just who they are and that's what they're like. It's
Right.
there's something going on, right? I think where what you have, the
Yeah, absolutely. And especially as they start going to daycare, nursery, whatever, when they're just surrounded by other germs, for some reason they would be sticky. We want to make sure their immune systems are like really pumping so that they can adapt to those, whatever it is they bring home. If you have a kid that's always the sticky kid, again, that tells me their immune system isn't adapting the way it's supposed to. So that's right. And recurrent ear infections is a big one that I see that, and like asthma.
awesome. And when you're seeing it from a newborn sort of concept, if a parent's coming in with a newborn, what does that look like in terms of when they come in for that initial exam and then post that, the sort of treatment side of things?
Yeah, so definitely I'm going to ask a lot of questions about the pregnancy and the birth process itself. I'm going to hear whatever the parent is concerned about. We'll do an evaluation that's going to consist of a lot of primitive reflex testing. You'll see me tickle their feet, their hands, the little sides of their face, just make sure that they're responding the way we want them to. If one seems a little bit hyperactive or hypoactive, not so much, that tells me again, the patient's not happening. And then the adjustment itself looks like we're doing nothing.
Yeah.
Because they're so tiny, but the pressure that you use is just the same that you'd use to touch your own eyeball or check the ripeness of the tomato. There's no twisting, no cracking, anything like that. It's just really tiny movements. And their little bodies are really smart, so they do the rest on their own. Yeah.
Wonderful. Awesome. And is there anything in particular that I suppose you touched on it before in terms of seeing them for like recurrent ear infections? Anything else that you find that you see that some people wouldn't think of when it comes to babies in chiropractic? Right.
Yeah, they're not going to tell you that they're having back or like a headache.
Coming out like, oh, well.
Yeah. But if your kid's like a headbanger, so if you notice that they're in their crib kind of doing this, or they always do this in the car seat, that tells me like that's their body trying to correct it on its own, but it can't do it.
Yeah.
So that's where I come in. Again, any sort of just things that people say are like normal or they'll grow out of it.
Yeah.
No, they'll grow with it.
Yeah.
So why wouldn't we just, it's a lot easier to grow healthy kids than it is to fix broken and sick adults.
Yeah, exactly.
So give them the easiest way forward if you notice anything that's a little off.
Yeah, get them checked.
Yeah.
Awesome. I think that's been the main stuff. I think that helps to tell everyone a little bit more about chiropractic, because I think we get questions all the time. And one of the sad things is when you get parents coming in and they say, oh, I didn't know you. And when I say, well, what is it about kids and chiropractic? Why would they need it? It's not like their bodies are small. I mean, no, there's a whole nother world to this.
Absolutely.
I hope that sheds a bit more light on that and gives people a little bit more information to go on with your time.